Hi, my name is Dr. Nilsa Rivera. I am a licensed psychologist here in Naples, Florida, and I can be reached at 239-434-2425, or you can find me on the web at www.nrphd.com. I've put together a short presentation about depression to give you some information about the topic. What is depression? Well, depression can take several forms and includes major depressive disorder, which is major depression, and it is a severe depression that interferes with your ability to work or have a personal life. It includes severe fatigue, sadness, sleep issues, eating issues, and possible suicidal thoughts or ideation. Dysthymia is another form of depression, which is a milder version of major depression, but one that lasts for 2 years or more. It is possible to have major depression while suffering from dysthymia, but in general the person is able to manage, quote unquote, their life, just with significantly less contentment. Bipolar disorder, previously called manic depression, is a type of mood disorder that fluctuates between depression and mania. A seasonal affective disorder is another form of depression where the individual experiences depression based on the season. It is believed that during this time the mind may be more susceptible to light, which causes a form of chemical depression. And adjustment disorder, which is a brief reaction to significant life events like the loss of a loved one, or a job, a divorce, or a medical event like the diagnosis of cancer or dementia of your spouse, which results in depression. It is not unusual and does not have to define who you are. This form of depression is quite treatable and does successfully respond to support. Depression has several symptoms. These are called neurovegetative symptoms, and several of them include that you experience a depressed mood for most of the day. There's a loss of interest or pleasure in daily activities, irritability, a disturbance in your sleep pattern, which is either you're sleeping too little or you're sleeping too much. There is a loss of interest, a loss or an increase in appetite. There's either a weight gain or a weight loss. There could be fatigue, difficulty in concentration. Many times low self-esteem or feelings of worthlessness also fall into play when we're talking about the symptoms of depression. In severe cases, there can also be the thoughts of death or suicide, and those are the ones which require immediate care. Overall, symptoms of depression can be managed effectively in treatment, and it's up to you to decide when you're ready for treatment and who to contact. Treatment itself includes therapy, and in the therapy, one of the main goals is to understand the depression and then to learn how to cope with it and to solve problems, to explore the causes, whether they're behaviors or experiences or relationships that contribute to the depression, and then ultimately to change behaviors and attitudes in a positive way. Medication is also a tool that is used to treat depression. Although I do not prescribe medication, I do work with your physician to coordinate care and can make a referral to a psychiatrist if needed. Again, my name is Dr. Nilsa Rivera. I am a licensed psychologist here in Naples, Florida. I could be reached at 239-434-2425, and my website is www.nrphd.com. Thank you for listening.